Hello, and welcome to Periodontal Therapy Virtual Laboratory. I'm Dr. Brook, a board-certified veterinary dentist in both the American and European Veterinary Dental College, as well as a fellow at the Academy of Veterinary Dentistry. Hopefully, as you went through the periodontal disease section, you gained some respect for how important it is to treat gum disease, and that you can now get your clients to say yes more. So now we need to do an effective job at actually treating periodontal disease. And that's what I'm going to take you through in this lab using high quality videos so that you can replicate it in your practice as you train. So without further ado, periodontal therapy. How do we treat periodontal disease? We remove plaque and then we control it long term. So it's a four-pronged attack depending on how bad the disease is. The first step is always a dental prophylaxis. And yes, I know there's a lot of other terms out there, COHAT, ATP, professional dental cleaning. And the reason that they came up with those is that they are trying to say that it's not just a cleaning, it's not just prevention. Well, ideally, we would get to the point where we're just getting prophies. That's what we get most of the time when we go to the dentist. We need to be doing these more often so that our patients benefit from them. But the first step is always a prophy, and that's what we're going to talk about in this particular lecture for the most part. Periodontal surgery is when you get pockets over 3 millimeters in a dog, 0.5 millimeters in a cat. Anytime you get beyond that, you need to do something else, and that's root planing and doxyrope or clinderol, some kind of periosteutic, or flap procedures, as we'll talk about. Home care is critical, whether it's active or passive, and then extraction is the cure. It's extreme, but it's the cure. So let's talk about a dental prophylaxis. It's got to be done under general anesthesia. I cannot stress enough how much I hate anesthesia-free dentistries, non-anesthesia dentistries, sedation dentistries, twilight dentistries, holistic, whatever the heck you want to call it. Some people call it holistic dentistry, whatever it means. Anything that does not include general anesthesia and the patient intubated and under anesthesia, no. The answer is no. Why? Well, first of all, just talk about sedation dentistry. It's not safer. It's not. I talk to anesthesiologists all the time, and they're like, yeah, no, sedation is actually in a lot of ways more dangerous than general anesthesia. You can't clean underneath the gum. And here's our friend right here. This is our example of you've got to get down below the gum line. And this is what anesthesia-free does. It cleans right down to the gum line, but it leaves it at and below. And if you recall from last lecture, until you're cleaning at and below the gum line, you're not doing anything at all medical for these patients. So you can't do an exam, you can't take x-rays. And so from that standpoint, it's a cosmetic thing only. It does not do anything. There are dangerous things that can happen. I've seen gum lacerations, I've seen jaw fractures, I've seen broken necks, I've heard of death under it, because it's not. And it's not a good thing for the pet. It's just not. It's stressful. You don't have an endotracheal tube in, so you can't protect against tartar being aspirated. The biggest problem that we have as veterinary dentists, well, maybe not the biggest, but my biggest one, is it gives the client and the veterinarian a false sense of security that actually the teeth are getting cleaned. Why? Because they look clean, but they're not getting down to the gum line. So it's not doing anything. So it delays therapy. And then what happens to me as a veterinary dentist is these clients come in and they have these pets that they've had anesthesia-free dentistry done every month or every other month for years. And then they come to me and I rip out all these clean teeth. Why? Because they haven't gotten underneath the gum. So this is why the WSAVA, the World Small Animal Veterinary Association, considers anesthesia-free dentistry an animal welfare concern. If you guys are fighting this, and if you're from California, you are, go onto the WSAVA website and look for the dental guidelines. We have 3 pages on anesthesia-free dentistry and how we just can't do it. Just can't. Okay, so once you have your patient under anesthesia, the first thing you want to do is to decrease the bacterial load. Why? Because the oral cavity is a significantly infected area, but not only are there bacteria in the mouth, The water lines of your dental equipment are full of bacteria, funguses, viruses, Legionnaire's disease, all this nasty stuff, unless you have a high quality filter that's being aerosolized into the area and into your staff, into your other patients in the hospital. That's why we think that dentistry should be in its own room. And you are going to create a transient bacteremia. So by decreasing the bacterial load in your patient, you're going to help them, yourself, the rest of the staff, and every patient in that practice for the most part.
So after we have our patient well under anesthesia and all of our monitoring hooked up, it's time to start with our cleaning. The first step that we always do is to rinse out the mouth with chlorhexidine oral rinse. You can get this from many manufacturers. This is one that we had privately labeled, and all you want to do is to make sure that you cover the entire mouth with this. This is going to decrease the amount of bacteria within the mouth that's going into your patient, as well as being spread out into the entire environment of your practice.
So the vast majority of supragingival, now this is the first step that most people take, it's cleaning above the gum line. The vast majority, is done with ultrasonic scalers. Some people use sonic scalers, and those are fine, but I particularly really like to do with ultrasonic. I think they're faster. I think they work better. So bottom line is we're going to be using a supragingival ultrasonic scaler. They vibrate at 30 to 40,000 cycles per second. Okay, so it's really fast, and it works via what's called mechanical kick, which is basically like a mini jackhammer. It vibrates the plaque and calculus off the teeth, but also something called cavitation. Cavitation is the ultrasonic wave set up an antibacterial effect within the coolant spray, and it actually lyses the bacterial cell walls and partially sterilizes the tooth surface. There are two types of ultrasonic scalers: piezoelectric, which has quartz crystals in the handle, and magnetorestrictive, which has magnetic strips. They're both fine. I think most of us use piezoelectric now, but they both work perfectly well. These are very efficient and relatively safe. We're going to talk about overheating and stuff like that as we go, but they are very efficient and relatively safe for your patient.
It is very important to choose the correct ultrasonic scaler tip. The really big ones are for supragingival use only. So you can see how big and thick this one is. This is going to be very good at removing tough pieces of tartar from the crowns of the teeth. But you don't want to use this underneath the gum because, number one, it's not designed for the water coolant spray to get too much to the tip, but also it's too powerful to use on the cementum on the root. So this is a supragingival tip. This one here in the middle is a little bit thinner than this one, but thicker than this one. This is called a universal tip. This universal tip can be used anywhere. It does work well on the surface of the teeth, but not as well as this one. And it does clean up underneath the gum, but not as gentle as the subgingival tip. This one you can use anywhere, and I generally recommend that most general practitioners use a universal so they don't make a mistake of using the wrong one in the wrong spot. If you're doing good subgingival cleanings, you should invest in a subgingival specific tip, really thin, longer, and the water coolant will come out and cool the tip of it very effectively. So in review, supragingival, don't put that underneath the gum. Universal can go anywhere. You should turn the power down if you're using this underneath the gum though. And then finally, a nice subgingival tip for your deeper pockets, which will gently clean the tooth without damaging it.
So your grip for your ultrasonic scaler should be very, very gentle. You don't want to hold it like a knife. You want to use the modified pen grasp, as I'll talk to you about when we come to hand instrumentation. Just holding it between the index finger and the thumb, somewhat supporting it with the middle finger, and then rested with your ring finger and your pinky finger there. Gentle. Dentistry is elegant. Dentistry is zen. You put too much pressure down, you're going to damage the instrument and damage the tooth. So when you're using ultrasonic as well as sonic scalers, you want to use the side of the instrument, not the very tip, but the side of the instrument, because the tip is just going to scratch it. Think of this like a jackhammer. You want to use the side of the instrument. Area of maximum vibration is the last 2 to 3 millimeters. Okay, if you're way, you can use 1 millimeter or whatever as well. But if you're way back here, 4 or 5 millimeters back, it doesn't have the vibration. The vibration is created here. So it's going to be much more effective cleaning there. You want to use in wide sweeping motions to cover every square millimeter of every tooth surface. We talk about cross hatching, going like this, up and down, and then back and forth and back and forth and back and forth. You want to touch every square millimeter of every tooth surface. Why? Because plaque is invisible. You can see tartar, but you also have to clean the plaque. And incipient tartar, or the earliest tartar, is not visible either. So you've got to, absolutely got to touch every square millimeter of every tooth surface. I tell people all the time, if plaque was green, there'd be no morning kissing going on. Because every day you wake up, your mouth is coated in plaque. And if you go over and roll over and smile at your husband, boyfriend, girlfriend, wife, and you have green teeth, which your teeth are coated in plaque every morning, so are your significant others, trust me. If it was green, you'd be like, oh, honey, go off to the bathroom, please, and brush your teeth. Just because you can't see it doesn't mean it's not there. Touch every square millimeter of every tooth surface.
In our practice, we do our cleanings in lateral recumbency, and we'll do the outside of this arcade and then the inside of the lower arcade. The first thing we're going to do is use our ultrasonic scaler to scale off the surfaces of the teeth and just up underneath the gum line. The key to using an ultrasonic scaler correctly is to first of all make sure that you have adequate coolant spray. If you don't have adequate coolant spray, it's going to overheat the tooth and potentially damage to kill it. So when you step on your pedal, what you should see is a nice fine spray of the coolant, and this will protect your teeth. When you're using your ultrasonic scaler, you want to use the side of the instrument, not the tip. The tip is just going to scratch the tooth. The side of the instrument is where it's cleaning, because you have to think about your ultrasonic scaler as a mini jackhammer. It's just pounding the plaque and calculus off of the tooth. So the way it's going to work is like this, or on the other side like this. Okay? The area of maximum vibration is the last 2 to 3 millimeters from the tip. So you don't want to have it on the very tip. You want to have the side of the tip right like that on the tooth at all times. If you're getting back here too far, it's not going to be very effective. So if you're having problems getting the tooth clean, rotate the instrument in your hand so that you can get that sweet spot against the tooth. So to clean the teeth, what we're going to do is start the instrument, okay? And then we're going to place it against the tooth. You'll hear that high-pitched sound. That's a good sound. And then when you place it on the tartar, you should see it just cracking right off. And just, you want to go over the tooth, keep it in contact with the tooth. As soon as you take the instrument away from the tooth, it's not doing anything. So what I see technicians doing all the time that drives me crazy is what I call henpecking. And they do this. And the problem is, as soon as you take it off the tooth, you're not doing anything. So put it on the tooth, leave it on the tooth, and touch every square millimeter of every tooth surface. Remember, plaque is invisible. If plaque was green, there'd be no morning kissing going on, because every day you wake up, your mouth is coated in plaque. And if it was green, your husband, boyfriend, girlfriend, wife would tell you to go to the bathroom and brush your teeth. But because you can't see it, doesn't mean it's not there. So you want to cover every square millimeter of every tooth surface, whether it looks dirty or not, and then move on to the next tooth. And you want to clean the entire arcade going all the way back. Now, one point. What you saw is that I kept this on this tooth for quite a while. There are people that will tell you don't leave the tooth in contact with your ultrasonic scaler for more than 5 seconds, 7 seconds, 10 seconds, whatever. There's no scientific evidence that says that a well-cooled ultrasonic instrument will ever overheat the tooth. As a matter of fact, the study showed that if you left a well-cooled ultrasonic instrument in contact with the tooth for 1 full minute, it did not overheat the tooth. Yet, if you put an uncooled ultrasonic instrument, like you turned the water off and ran it dry, it overheated the tooth in 1 second. That is why it's critical, number one, to have good coolant spray, and number two, make sure if you're inducing this underneath the gum, that you have a subgingival or universal tip so you don't overheat the tooth underneath here. And so all you're going to do is clean the entire surface of all these teeth and do the inside and then roll them over and clean the other side. And then you're done with your ultrasonic scaling.
So we don't do a lot of hand scaling anymore. In general, we let our ultrasonic do most of the work. But we should know how to do hand scaling, so I'm going to teach you how to do it. It's not all that efficient, but it's safe. It's no chance of overheating the tooth, no chance of damaging the tooth. I really like to use it as a final check of cleaning quality. Remember, a smooth tooth is a clean tooth. If you're feeling it and it's rough, then it's probably dirty. Again, numerous overlapping strokes, and you want to use a modified pencil grip. Here it is, the modified pencil grip. Hold the instrument only with the thumb and forefinger right at the end of the gnarled or rubberized edge. Your middle finger rests on the terminal end or the shank of the tooth or of the instrument, and this is what you're going to feel for any roughness with, and also put pressure down onto the tooth to clean. And then again, your pinky finger and ring finger are your rests. This is what's going to help you avoid carpal tunnel. It's also going to give you maximum tactile sensitivity. Hand scaling, okay, again, we're still supra or above the gum line, supragingival, is going to be done with a scaler. You can use curettes above, but I prefer scalers because they're easier to sharpen. They're cheaper than curettes for the most part. They're sharp here, sharp on the back, sharp on the tip. So these do not go underneath the gum because it's going to lacerate the gingiva either with the back or the tip. This tip is what I'll use for those developmental grooves in dogs' upper fours or blood grooves in cats' canines.
This is a scaler. Scalers are triangular in shape. They come to a sharp tip and a sharp back. These are only used above the gum line. You can use either side. It's called universal. You can scale with either edge of this. And they generally are straight up and down, meaning that there's no accessory bend. They do make area-specific scalers, but they're more rare. So this is what we're going to be using to clean above the gum line. So this is the type of scaler that I personally recommend. It is a jaquette on this side for tight areas and a sickle scaler on the other side for big chunks of calculus. So this is generally the scaler that I will recommend, although many of them are acceptable.
So when you're scaling, you want to start at the gum line and pull away because you don't want to go towards the gum line or else you'll slip and lacerate the gingiva. So what I really want to show you in this picture is when any hand instrument is working, is when the terminal end is parallel to the tooth. So that's when it's working right there. So if you don't have that parallel to the long axis of the tooth, your blade is not engaging the calculus. Start at the gum line, make the shank parallel to the tooth, put some pressure down, and pull. Numerous overlapping strokes until the tooth is smooth.
So the next step is optional, and not everybody does supragingival hand scaling. I'm going to show you how to do it because I do believe it is an important part of the cleaning. In order to do this, you're going to use a scaler. As discussed in the instrumentation section, scalers are typically straight up and down, and they're triangular in shape, and they can be used on either side. So what we're going to do is the modified pencil grip. We're going to place the instrument on the tooth so that the terminal end, that shank right there, when the terminal end is parallel to the tooth, that's when you're engaging the tartar and the plaque. place the instrument firmly against the tooth, put a little bit of pressure down with your middle finger, and pull straight out. And you should feel a scrape. And you're going to start at the gum line and pull away so you don't lacerate the gingiva. Numerous overlapping strokes until the tooth feels smooth. One important point that I see people do is you may not supinate. One of the challenges people do is when they clean, they do this. They pull like that. When you do this, as soon as your instrument goes from here to here, you're not doing anything. You're just burnishing the calculus. So you need to make sure as you come through that you keep it parallel to the tooth surface. And then once it feels smooth, you're done with your supragingival cleaning.
Okay. Now that we've finished with the supragingival
So
part.
now we're going to do.
Sorry about that. Now that you've finished your supragingival scaling, we're going to move on to the subgingival scaling. This is the most important step of a prophylaxis, by far and away. If you're not cleaning up underneath the gum, you're not doing anything at all. Generally, it's done by hand with a curette, okay? But with the newer ultrasonics or a sonic, you can clean up underneath the gum. I really think you should be doing both. If you have no pockets at all, you can certainly do it. The thing is you're not completely getting it clean. So you've got to get up underneath the gum.
So now we're going to do the subgingival scaling. And you can certainly do a lot of this with an ultrasonic scaler. But again, like we discussed in the equipment section, you've got to have a subgingival tip. If you notice, this is a finer tip than what I used for the supragingival part. So now we're going to do the same thing where we turn it on. This should be a little bit lower power. And then you're going to go underneath the gum line. And I think that your subgingival scaler does a pretty good job cleaning down to about 3 millimeters, which is normal for a dog. And now you're just going to continue that along the arcade and making sure you get everything clean. Because remember, the subgingival cleaning is the most important.
Okay, so hand scaling under the gum. This is I'd say lost art, but it was a never learned art in veterinary medicine. This is a critical piece of equipment for cleaning up underneath the gum. And again, if all of your sulcal depths are less than 3 millimeters, you don't necessarily have to do this. I like to clean up, 2-3 millimeter pockets with this because again, I can feel it. But anything over 3, you need to do some type of hand scaling. So this has got 2 cutting edges, okay? One here, comes to a blunt back and a blunt tip. This is what we're going to be used under the gum line.
This is a curette. A curette is not triangular, it's more rounded. So it has a blunted tip and a blunted back. Curettes are what we're going to use below the gum line. You could use it above the gum, but they're more expensive and more difficult to sharpen. So I use these under the gum, and you generally only use one edge as a cutting edge because the other side is against the gingiva. Curettes also have an accessory bend for the most part. They do make straight up and down ones called universal, but the Gracie curettes have this accessory bend. And as we're going to see when we get to the actual subgingival hand scaling, is that this allows your hand to stay out of the mouth while you're getting up underneath the gums. The next step is subgingival hand scaling. I don't do this for every patient. Where I do it is when I find pockets that are more than normal for the species, which means more than 1 millimeter in a cat and more than 3 millimeters in a dog. However, I don't do them when I find pockets that are over 6 millimeters. Why? Because you cannot clean pockets greater than 6 millimeters without making a flap so you can see the root. So where do I do subgingival hand scaling? I do it in pockets that are 4, 5, or 6 millimeters in a dog. And of course, if they don't have horrible furcation exposure and mobility, etc. And then 2, 3, 4 in a cat. Those are the times that I'm going to be doing subgingival hand scaling. And the key is you need to charge for it. When you find a 5mm pocket in a dog, you have gone from preventing disease to treating disease, and you need to charge for it. And so I would do the subgingival hand scaling, I would do a nerve block, I would take an x-ray, I would put in clinderol or doxyrobe, and I would charge for every step. That's a key in making your dentistry make sense.
So to do subgingival hand scaling, you're going to place the instrument, you're going to bring it in, okay? And so your hand's going to be a little bit in the mouth. You want to hug the tooth, I call it. So you're going to flatten it out, and then you're going to insert it gently underneath the gum because this decreases the profile, okay? So then you insert it up to the bottom of the gum. So having it like this on its side, you can go over the tartar, you get to the bottom of the pocket, and again, gently. And then when you get to the bottom of the pocket, you rotate it till the shank is parallel to the tooth. Okay, so when the shank is parallel to the tooth, remember, that's when you're engaging the calculus. Put some pressure down and pull. Numerous overlapping strokes until the tooth feels smooth.
So to do subgingival hand scaling, we're going to use a curette. And as we discussed in the equipment section, it only has one cutting edge down here, and it has an offset blade. This is a 12-13 curette, where you have a big accessory bend, and that allows you to keep your hand outside of the mouth when you're doing the subgingival scaling. So you want to start with the instrument so that the shank, that terminal end right there, when that shank is parallel to the tooth, that's when you're engaging the calculus. So what you want to do, get your modified pencil grip again. Remember, your middle finger should go right on top of the shank, your thumb and your index finger, just the tips there, and then rest on the dog. Pet the dog. He wants to be petted while you're doing your work, okay? Rest on something. Then start with the shank parallel to the tooth, then rotate the instrument down to decrease the profile, okay? So you're bringing the profile down like that. That's going to let it slide over the tartar, down gently to the bottom of the pocket. Once you reach the bottom of the pocket, rotate the instrument so that the shank is parallel to the tooth. When the shank is parallel to the tooth, put some pressure down, pull straight out, and then repeat until it's nice and smooth. You're going to rotate in, go to the bottom of the pocket, rotate up to parallel, and pull. Numerous overlapping strokes until the tooth feels smooth. Your tactile sense is very important here. And the other thing to remember, it's very common for people to want to supinate as they come out. Remember, as soon as you go from here to here, you're not doing anything. And once you've gone through this and it feels nice and smooth, you've cleaned up that pocket and you're ready to move on to the next step. So when it comes to hand instrumentation, there are a ton of manufacturers, a ton of different options. They're all fine. Two easy examples that we recommend. This is the Weldon Periodontal Kit created by Integra Miltex. It's got 2 curettes, 2 scalers, a mirror, and a probe explorer. And then this is the simple scale kit put together by Dental Air. There's scalers, there's probe explorers, there's curettes, everything you need, nothing you don't. Either one is fine, or you can buy them individually, whatever you have, as long as they're good instrumentation. These are just 2 good examples of kits that you can purchase.
These instruments must be sharp. If they're not sharp, they're just burnishing the tartar and not treating anything. Honestly, you guys should be sharpening weekly. If you're not and you haven't, it's almost worthless after a year. If you have never sharpened your instruments, it's probably going to be a big challenge to get them sharp without doing something significant. So professional sharpening is a good answer, or honestly, buying new. How do you sharpen an instrument? All you need is an Arkansas stone and some oil, and you put it on the stone the way it's going to be used in the mouth, which would be parallel. Bring it off 20 degrees. So 20 degrees, remember, is a peace sign, and then just go back and forth and back and forth. So this will show you how to do it. And you should be sharpening weekly or more often.
So all you need to sharpen your hand instruments is an Arkansas stone, some sharpening oil, and I do recommend an acrylic testing block so that you can see that your instruments are nice and sharp. So these just happen to be Dental Air's product numbers. You can get it from any of your suppliers. So remember, the most important thing is your Arkansas stone. That's what we're going to use to sharpen our instruments. To sharpen your instruments, place a small amount of oil on the stone. When you're sharpening a scaler, start with the instrument on the sharpening stone, how it would be on the tooth. So in this situation, the whole instrument is parallel to the stone. That's how it would work on the tooth. Bring it up 20 degrees. Remember, 20 degrees is a peace sign. And then back and forth, back and forth, back and forth. And then you want to end coming towards you so you don't burr the instrument. And then you can flip it to the other side. Again, start parallel, bring it up 20 degrees, back and forth, back and forth, back and forth, back and forth, end coming towards you. And then continue that until it's nice and sharp. To sharpen a curette, it's very similar. Again, put the instrument on the stone the way it would be on the tooth with that terminal end parallel to the stone, and then rotate it up 20 degrees off of it, back and forth, back and forth, back and forth, end coming towards you. You may want to rotate it in your hand to get that whole curve, just like this. And again, always end on the pull stroke, and that will get it nice and sharp. And you do only sharpen that one side of a curette.
So like I said, professional sharpening will really help your older instrumentation get back to a nice sharp edge. If you guys have not sharpened it a long time, you can grab a stone and it's going to take forever to get it back to a nice sharp edge. You may not be able to. If you have old equipment that's dull, you can either, like I said, replace it, buy a new one, or we do offer veterinary dental sharpening service, $5 an instrument. We'll get it back to a nice sharp if we can. If we can't, we'll tell you and tell you how to replace it. So it's on the website, dogbeachvet.com, and you can look up the sharpening service and it'll help you out. All right, polishing. In my opinion, it is very important. I know a lot of veterinarians and human dentists are going away from it because they say you get a nice smooth tooth with your scaling. I don't buy it. I think on the human side, they do because, again, hygienists spend 2 years learning just how to scale teeth, pretty much. We learn if we haven't learned at all, even based on this lab, we're not going to be perfect, anywhere near as good as they are. Plus, our instrumentation is not near as good as theirs. So I do believe we are going to be leaving a roughened tooth surface. And when you do that, like we talked about in the periodontal disease standpoint, the roughened tooth surface is going to increase plaque and calculus buildup much faster. So that's why, people say, well, I don't like to clean dogs' teeth too often because it comes right back. It's because they're not leaving a smooth tooth surface. So you've got to polish it, which will lengthen the life of your prophy.
So for polishing, you can certainly use a commercial prophy paste. We prefer not to because we do so many bonded sealants that we don't want to use the fluoride. So we mix up a combination of laboratory pumice, it's just flour pumice, you can get it from anywhere, and then the chlorhexidine rinse. You could use water as well. So just a small amount of the prophy polish, and then just add an amount of chlorhexidine to make it into a nice slurry and mix it up. There's nothing magic about how much it is. There's no important amount. It's not critical, but just you want to make it into something that's a little bit of a slurry. So it needs a little bit more liquid there, and it's a wee bit messy, but I think it's a little bit better for your patient. So once you get it all mixed up, it should look something like there's a little bit more. I don't want to make it too soupy if it doesn't stick real well, but something that looks like that will work quite well. And so this is what you're going to use for your polish.
So the next step is to polish the teeth. And yes, I know that some human dentists are going away from polishing after scaling because human hygienists do a really good job of getting very, very smooth teeth. I don't think we're that good. I mean, again, I always tell people, human hygienists spent 2 years learning how to scale and polish teeth. 2 years. We spend, Most people have no training. Or if we have, I mean, even with this lab, you're not going to get that much training. So you're going to leave a rougher tooth surface, and your instruments are not as good as theirs unless they're brand new. So again, we're going to leave a rougher tooth surface. So I polish. I strongly recommend that you do. The other thing is you do get cleaning with polishing. So you remember that green plaque, you can't see it, but the surface area of polishing for the insipid plaque and calculus is going to do a good job of getting it clean. So I think people underestimate the amount of cleaning they get with the polishing as well. One important point, you need to flare the cup to get up underneath the gum. So you have to put some pressure down, and that'll flare the cup to get up underneath the gum to polish. Because remember, it's the most important place to clean, it's the most important place to polish. The one other thing is this will overheat the tooth given time, so you have to use plenty of polish, and then don't use it for more than 3 to 5 seconds per tooth. You can go back to it after you've let it cool down, but the frictional heat will cause an issue with that.
So the next step is to polish the teeth, and we're going to use a prophy angle, and we use disposable ones so it's nice and sterile for each patient. One of the keys when you're doing polishing is not to have this going too fast. What happens so often when I go into practices is this thing's going 1,000,000 miles an hour, and that's going to overheat the tooth. So what it should sound like is something about like this. That's a nice speed. If it doesn't sound like that, there is a little black dial right here that's your speed control. And you can turn it, hear how it's getting slower and faster. You want to have it about right there, just above stall speed, and that will polish the tooth without overheating it. So now we're going to polish the teeth. We've got our prophy paste all mixed up, so we want to get a good amount of the prophy paste. One important point, make sure to use plenty of prophy paste. If you don't, it's not going to polish very well. Remember, the polish does the polishing. The prophy cup just serves to move the polish. So number one, you're not going to polish very well. But number two, this is also a lubricant. So it's going to decrease the friction so you don't overheat the tooth. So always get plenty of polish, and I'll usually kind of smear the tooth with it to start. And then start your prophy angle, put some pressure down. You should flare out the edges like that a little bit, and always put some pressure down to flare up underneath the gum a little bit. And that way you're going to clean the subgingival area as well. And again, cover every square millimeter of every tooth surface, remembering the green plaque. And then after you polish the entire arcade, you can flip them over and do the other side.
So after you've scaled and polished the teeth, the next step is to do the dental exam, probing, charting, and treatment planning. In my opinion, this is the second most important step of a cleaning. I find more pathology that is more important than the cleaning part very often. Very, very often. So always do a good oral exam. And you really should be stressing to your clients. They think that a dentistry is a scale and polish, but it's way more than that. The oral exam is critical, but you got to do a good job. You have to look under the tongue. You have to look down the throat when you're intubating. And then you need to also use the Explorer on one end, which is right here. This is the Shepherd's Hook Explorer. And then you also need to use the probe, because the probe is what you're going to find these pockets. So this is exploring along the gum line for tooth resorption, and this is doing periodontal probing.
So a critical piece of equipment that every practice must have is a X-Pro or Explorer periodontal probe. The periodontal probe end is what you're going to measure pocket depth with, and then your Explorer end is what you're going to check for pulp exposure, tooth resorption, or caries. And you've got to use this on every single patient every time.
So using a probing is to measure the pocket depth around each tooth. You will miss it. You cannot rely on the look of the gingiva to determine if pockets are there. This will increase the quality of your cleaning, allow for diagnosis, so you're going to treat patients more effectively, and it's also going to allow you to create some more income. Examples, really quick, simple examples. Beautiful, happy, healthy gums. Look at that, no tartar, 9mm pocket. Again, beautiful, happy teeth, no inflammation, 11 millimeter pocket. This tooth has actually got a class 2 perioendo lesion on it. It's not loose because it's being held in by these mesial roots. Now, if you wouldn't have probed, you would have missed these. You would have seen this on x-ray because this has periapical lucency. But with the overlap, everyone says, oh, well, I would find these pockets on x-ray. You would never see this on x-ray unless you were looking with a fine tooth comb, because you've got so much overlying tissue here with the tooth in here. It's so dense that you would not see that pocket unless you were super careful. So please probe every surface of every tooth. Here's another quick example. Look at the gorgeous gums. Look at how no tartar, everything's great. Look at where that probe is sitting. Here's your x-ray. Now you would have found that this tooth was loose, but you would have totally missed all this infection if you wouldn't have probed. So please probe every surface of every tooth. It takes about 2 minutes on an average patient. So how do you probe? Place the probe between the tooth and the gum and just tap. I call it walking around the tooth. Tap, 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 all the way around the tooth. It will fall into a pocket is there. You want to measure those 6 spots on every tooth. Now, I don't mark anything, below normal for the species. So anything less than 3 in a dog, I don't mark. I don't do 1s and 2s. I think it's a waste of time. But anything over 3, you should mark.
So this is an example of a periodontal probe. Note that there are probably 50 different markings that you can get. This is just one of them, and probably my favorite. In this particular one, each one of these lines is 1 millimeter. So that's 1, 2. When it gets to this darker line, the first part of it's 3, the back part of it's 5, then 6, 7, 8, and then 9 somewhere in the middle, 10, and I hope you're not getting very often up into this area. But you've got to know what each one of these markers means, because sometimes they do 3, 3, 3, and 3. So make sure you know what is the right markings for your probe, and then use it appropriately. So the next step is the oral exam. In my opinion, it is the second most important step of a cleaning, because you find so much pathology that needs to be treated, and that's really where you make a difference in the health and welfare of your patient. So you want to do a complete visual exam. Make sure you check, in the cheeks, make sure you check down the throat, under the tongue. But the really important thing is to use your periodontal probe. And you want to check every surface of every tooth. You don't mark everything, but you want to make sure that you're checking every surface of every single tooth, because you can't see pockets. So what we're going to do is angle slightly towards the tooth and just walk. Just tap, 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 tap all the way around the teeth, starting on midline and going around each tooth. So you can see all of these are nice and normal. So I'm not going to really say anything. I don't mark normal. When we get to this canine, you can see where it drops down here. That's dropping down to about a 5 millimeter pocket right there. So we would want to mark that on our dental chart, as we'll show you in a little bit, and then work around and around and around all these teeth. You also want to put your probe to the side and check for furcation exposure on all these teeth as you go all the way back. You would also be using your explorer if you have a fractured tooth to feel for pulp exposure. In the back, way back here in these molars, to check for cavities. In cats especially, to check for tooth resorptive lesions. You want to do a really good job of doing a very thorough oral exam. And again, after you've cleaned the teeth. I have not obviously cleaned all these teeth back here as part of this demonstration.
So normal sulcal depth of a dog is 0 to 3 millimeters. Cats, 0 to 0.5 millimeters. Any pocket in a cat is considered abnormal. All abnormal findings need to be recorded in the medical record. So here, like our little friend over here, he's measuring, and everything's less than 2, so he's pretty happy with it. So I know that this is not normal knowledge or common knowledge in veterinary medicine. So Dental Air and I created a color-coded probe. So the first millimeter is green. If you can see green, you're good, either species. If you can't see green, you're doing a cat, you got a problem. The third millimeter is blue. You can't see that blue line in a dog, you have a periodontal pocket that needs to be treated. And as we're going to talk about in a little bit, pockets over 6 millimeters can't be cleaned without seeing the root. and that's called periodontal flap surgery. So once you're above that, you can't see this red, you either need to extract it or do periodontal flap surgery or refer it for periodontal flap surgery, as we're going to discuss. So the probe is available on our website again, dogbeachvet.com, under products. Charting is absolutely critical, absolutely critical. If you are not doing a dental chart, it's a legal problem. And in California, was an expert witness on a case that they did get in trouble, even though they did a good job writing down their findings. It was on a chart. It allows you to follow the periodontal health as well as evaluate home care. This is our chart. This is available for anybody. If you want our chart, we're happy to email it to you. They're just Word documents. My email you have access to. Send me an email. I'm happy to send you these charts. They're really nice because they talk about mobility here. So just 1, 2, 3, furcation exposure there. I don't usually use the periodontal disease marking, to be honest. You would mark any gingival recession, any fractured teeth, and then these bullseyes are your periodontal probing. So you're looking down buccally. So if you had a 5mm pocket buccally, you would darken that one in right at 5. Same thing over here. And then all your abbreviations are up here, like tooth fractures, enamel hypoplasia, and then your treatments are down here. So whether you extracted it, if you extract it, you put an X through it. If it's missing, you circle it. So everything's self-explanatory on these charts. It's really nice. And again, if you want them, just let me know. I'll send them to you. If you have ones that you like, that's totally fine as well. I can't stress this enough. Yes, I know, my clients don't want to pay for x-rays or, whatever. Yeah, you've got to take x-rays. There are numerous studies, study after study, that shows how critical x-rays are. Dr. Verstrati study talked about the value of full mouth x-rays in dogs and cats. You've got to do it. I always recommend full mouth x-rays on every patient. Young large breed dogs, maybe not every time, although I always recommend it. But any problems, even those little chip fractures, as we talked about in the oral pathology section, you absolutely need to x-ray. And if you guys are taking x-rays and you're just getting started, we do have telemedicine available. That's our website, vetdentalrad.com. And if you go there and you sign up, we offer stat reads, which we're the only practice that does that, as far as I know. And within 20 minutes, if you send us a stat read and you call our practice and say, we have a stat read, I need someone to talk to, we'll get a board certified dentist on the phone with you to talk you through every tooth in that mouth based on x-ray, tell you how to treat each one. That's normal, that needs to be extracted, oh, that looks like cancer, whatever. So we have board certified dentists on the phone where we'll sit there and walk you through it. So something I like to do, you don't have to do this, but the problem is the vast majority, when you're doing a cleaning, vast majority of the time, you're going to do something else. It's rare not to do extractions or a biopsy or periosurgery or something. So the problem is that, as we've talked about before, and we'll talk about in a few minutes with home care, by 2 weeks, because you say soft food and no home care for 2 weeks, by the end of 2 weeks, you've got plaque, calculus, and gingivitis starting again. So the issue is you need a bridge. I talk about a bridge to other forms of home care. So the Oravet dental sealant has been shown in studies to work for at least 2 weeks. And so they do have a home care version as well, which I actually like, but not everyone does, and clients don't do it, right? I would love if they did, and I do send it home on occasion, but I put it on every animal that leaves my practice unless the client declines, because it gives you that bridge to other forms of therapy.
The last step of a cleaning that we do in our practice is to apply Oravet barrier sealant. Why? Well, because we know that plaque forms in 24 hours, tartar in 3 days, and gingivitis can start as early as 2 weeks after a cleaning without home care. And unfortunately, most of the time that we do cleanings, we're also doing extractions or some kind of oral surgery, which means no home care, whether it's brushing or chew-based, can be instituted for 2 weeks, and by that time, disease has already started. I use the Oravet barrier sealant as a bridge to other forms of therapy because this keeps the plaque from forming for 2 weeks. So all you have to do is dry the tooth. Once the tooth is dry, place a small amount of the sealant and then just rub it in. You're not going to see it, okay? But it's going to be there and it's going to protect the tooth for 2 weeks during that healing time and then the client can start other types of home care.
So, speaking of home care, it is a critical part of periodontal therapy. As a matter of fact, on the human side, they say that if you don't do home care, even if you come to the dentist every 6 months for cleaning, if you don't do home care, it's essentially worthless to have the cleanings done. Because again, plaque forms in 24 hours. Every day you wake up, your mouth is coated in plaque. In 3 days, tartar starts. And in just 2 weeks, gingivitis has started again. So you're already back to infected. So if you're doing annual cleanings, every February, Fifi comes in and gets her teeth cleaned, but you're not recommending any home care, or the client's not doing home care, those pets are infected 50 weeks a year. It's not good care. Oh, by the way, if you treat pockets, they're the same depth in 6 weeks. There's study after study that shows that bacterial counts are the same right away. So you've got to be treating these more sooner, because within 24 hours, they're already getting nasty again. So there's 2 major divisions. There's active, which is brushing and rinses. Clients have to actually do something. Or passive, which is nutrition and chews and treats and stuff like that. They both can be effective if properly formulated. Active home care is always going to be the gold standard. At least now it is. Okay. The problem with active home care is it requires some to much effort by the client. The client's got to do something. By far and away, toothbrushing is the most common type. It is incredibly effective in controlling gingivitis, plaque, and calculus and periodontal disease. But it's got to be done consistently over time to be effective, which is really hard for many clients to commit to this. If the client stops brushing for even a short time, gingivitis is coming back. So you don't have to use any toothpaste, to be honest. I do like the CET Veribac products. You don't have to have them. There's lots of them out there, lots of different options out there. But I like them. The studies that show that just applying it with your finger with the gauze and that actually helped gum disease was with the Veribac product. So I do think the enzymatic ones help, but you don't have to have them. It's just like brushing your own teeth. 45-degree angle to the gum line, rotary motion. Hard to get to the inside, but with practice you can. How do you get your dog to brush the teeth? Start young, be consistent. Okay, make it positive. This is my old Labrador Kaylee, who has since passed. She loved her teeth brushed. Why? Because she got dinner afterwards. So use food treats if your pet's food motivated, brushing, walks, things like that. Chlorhexidine, I do understand maybe that Veribac isn't making chlorhexidine anymore, but if they are, that's a great product. If not, you can get it from some place. It's got a long track record for being very good at decreasing gingivitis and plaque. No known method of resistance. So if you have a pet that's got chronic gum disease and you really want to pull out all the stops, brushing with chlorhexidine would be great. Another product that I really like, especially for cats or in the post-operative period, is MaxiGuard or Orizin. They're very similar. They're from Addison's Biologics. They're tasteless, so they're great for cats. All you have to do, I believe David Clark did a study where all you do is apply it to the teeth. It's like a gel. It's a viscous gel. Wipe it across the teeth every day. It has been shown to decrease plaque biomass and decrease gingivitis, but it also has vitamin C and zinc and stuff in it, so it supports collagen synthesis and may improve healing as well. So the problem is that you notice the client has to do something, whether it's brushing, applying, something. And unfortunately, clients just don't do it. 1% of clients brush their dog's teeth every day. Less than half, or like half of even A-plus clients were brushing after 6 months. So the problem is they may be going, yes, I'm going to do it, yes, I'm going to do it, but they typically fall off. And that's, it's the same thing. Diets fail. People yo-yo and put the weight back on because they can't be consistent. Same thing with this. So if your client is really an A-plus client, is going to brush every day, great. They can just brush, and that's going to be awesome. If they're not, ask them to be honest. Passive home care is effective, again, if formulated correctly, because client compliance is hard to obtain. The thing about it is, there are a lot of products out there with claim efficacy, lots of them. But if you go and ask them for research, like if you go online, you're going to find a bunch of products out there. You go to the pet store, you're going to find tons of products out there. Go to the major conferences, you're going to find lots of different companies that claim efficacy. If you look at the research, there's zero scientific evidence that they do anything for most of these products. So if you look them up and there's no studies or white papers or something, run away. Don't bother. I don't care if Dr. So-and-so likes it. I don't care if they've got pretty pictures. Don't. So you've got to do the research. I'm sorry, but you have to do the research. Look for ideally peer-reviewed published studies. That's what I go for. If I get a patient, a product that has published peer-reviewed studies, that's going to be my number one. Problem is not a lot of products do. And you can, just because they don't have science doesn't mean they don't work, but I want proof. For busy practitioners, the Veterinary Oral Health Council can be beneficial. It basically looks at studies and says, yep, this product does decrease plaque and calculus. And the other thing that's nice about the VOHC is they've added safety, so making sure that the product is not too hard to break teeth. But here's my issue with studies, any studies, published, unpublished, whatever, as well as the VOHC. It tells you that there has been plaque and calculus reduction, but it doesn't tell you where the plaque and calculus has been reduced. So the problem is, if it cleans the surface, you might get 50% plaque and calculus reduction. Oh, by the way, to get VOHC approval, you only need like 20% reduction. But if it's the 20% at the incisal edge, remember, it's not doing anything really medical. So it's got to get down to the gingival third. So first of all, the kibble size needs to be bigger. If it's a diet, okay, it needs to be bigger. So this is, and I'll talk about it again, this is TD from Hills Pet Nutrition. No, I am not paid by Hills to say this. Have I spoken for Hills? Yes. I've spoken a lot for Hills in Canada. Why? Because the product works. Not only has it been proven or shown in studies, numerous studies, but I've used it in my practice over and over. It works, okay? So bigger kibbles are nice. This is small diets, this is regular TD, and this is standard other dental diet type stuff. So they're not going to chew that, they're just going to swallow it. So a dental diet has to have the correct size, shape, and most importantly, structure for plaque and calculus removal. It needs to allow the tooth to enter into the product and clean all the way down to the gum line. If it doesn't, it's not going to be effective medically. So I looked at pretty much, if not every, dental diet that was out there. And all except for TD, basically they're all hard kibbles. They're coated with hydroxyapatite or something like that, some plaque and calculus reducer. But in general, they break apart at the incisal edge and they clean the surface of the teeth, but they don't get all the way down to the gum line. And so it's not doing anything medical. So this is dry erase marker. These are my hands and a dental diet that I bought from a pet store. It says dental diet. It has proof that it decreases plaque and calculus. The problem is when you put the kibble in, it shatters when the dog closes its mouth. See that? And then you put another one in and it shatters. And then you put another one in. And, whoops, it fell in. He doesn't have a tongue. So I give him another bite. And you can see that we're getting about 15 to 20% plaque and calculus reduction, but it's not getting down to the gum line. So most dental diets don't do anything medical, in my opinion. Effective methods have to be soft, like the moon made of cheese, to scrape all the way down to and including the gum line. One of my favorites is the Orvet Dental Hygiene Chew. Why? Because it's got the consistency to hold on to the tooth all the way down. But it also has dimopinol, which is an anti-plaque agent which spreads throughout the mouth and decreases the amount of disease elsewhere, at least theoretically. So here it is, same doctor's hands, same dry erase marker, same skull. When I put the product in and I close the mouth, look at how it holds onto the tooth all the way to the gum line. Look at that. Now you're scraping the tooth all the way to the gum line. You can see after one bite, look at how clean it's getting. If I give it a couple more bites, you're going to see how it's engaging the tooth all the way down to the gum line, getting it all nice and clean. I'll turn it around one more time. You can see how it engages all the way and how everything is getting, look at this down here. Look at how clean that is after just 2 bites. It works really, really well. See how clean that is? Look at that. That's helping your dog's teeth, plain and simple. The other one is TD. I've talked about it. It keeps it clean all the way down due to the fiber arrangement in the kibble. Again, same doctor's hands, same dry erase marker. You put it in, and when you close it, I got to hold it there because remember it doesn't have a tongue. But see how it engages the tooth all the way down to the gum line before it breaks apart right when you get to the bottom. Look at that. One bite through. Look at how much has been removed. But again, that other kibble got, 5 to 6 bites. So this one should get several as well. So you'll see, again, it breaks apart all the way down at the gum. So it does a really good job of cleaning this animal's teeth. I think this is a great product. I think it should be used on every patient. But you can see it's after just a couple bites, it's removing, 80 to 90% sometimes of the plaque and calculus. I mean, their studies don't go near that high, but look at how much more effective this is than those other dental diets. And again, I'm not paid by Hills. I'm not paid by BI. I just think the products work. All right. Okay. I have lectured for TD and BI and Verback. But honestly, it doesn't matter whether you buy their products or not. I don't get paid for buying their products. I lecture because I believe in them. Other products that I do like Greenies. I do like rawhide chews. I think they work pretty well. Especially I like the Verback rawhide chews. VeggieDents I think work well. I don't have videos of those, but I think those are good products as well. There are a lot of products out there. Do your own research. Those are just my favorites. So periodontal surgery, most dogs are going to have pockets over 3 millimeters. They are. And these pockets are pathogenic and absolutely need to be treated to control periodontal disease. This will improve the patient's health, and charging for it is important. So pockets in dogs between 3 and 6 millimeters that don't have furcation exposure, that aren't loose, should be treated with closed root planing, a combination of ultrasonic with a subgingival or universal tip, and a curette. Okay, get it nice and clean, and then add a parasutic. I'm a big believer in parasutics, whether it's Clinderol or Doxyro, and you should be charging for it. Absolutely should. But once you get pockets over 5 to 6 millimeters, okay, 6 is, I think, the magic number. If you got less than 6, you can decently do a job. Depending on what reference, over 5 is a problem, but anything over 6, you got a 7 millimeter pocket, you are not going to be able to get that clean without direct root visualization. I'm sorry, it's been proven over and over. Furcation level 2, which is halfway through, and furcation level 3, which is all the way through, again, you can't clean it without seeing the root. So you have 3 options. Either one, refer it for periodontal flap surgery and guided tissue regeneration. I love doing these procedures. They work really well in the right instances, especially for strategic teeth, canines and carnassials. Or learn how to do it. We teach it in our level 2 course usually it's in February. I think in 2021, it's going to be on the 3-day weekend in February. But in February and March, we teach it. Learn how to do it. You're going to do a lot of it. And you're going to make money and you're going to save teeth. If you don't know how to do periodontal flap surgery, the client doesn't want to be referred, pull the tooth. Yes, I know it may be an 8 millimeter pocket in a Rottweiler canine, but you're not getting rid of the infection. So here's the examples. So this is a 7 millimeter pocket, a 9 millimeter pocket on the inside of an upper canine. We did a great job. My tech and my resident did a great job cleaning down 6 millimeters. Look at the tartar at the bottom. I'm telling you guys, I didn't believe it either. I thought I could clean these deep pockets. They feel good. Not even human periodontal surgeons can clean these deep pockets. Same thing with furcation exposure. If you got furcation 2 or furcation 3, and this is an upper fourth, I'd probably do periodontal surgery with guided tissue regeneration, bone graft. This one would come out in my practice every single time. And then extraction. Extraction is the cure. It's extreme. I know you don't like to pull teeth. I think of extractions as amputations. But if you've got a gangrenous finger, you're better off without it. Okay, and then you just, and again, be careful not to break the jaw. So extractions we'll talk about in the extractions lecture if you're signed up for that. Minimally invasive surgery. I like minimally invasive, small, sharp instruments. Always take preoperative grafts. I like envelope flaps as opposed to full flaps. And again, hands-on training is the best, but we'll talk about this in our in our extractions lab. So that's periodontal therapy. Hope you liked it. Watch it over and over. Practice, practice, practice. Practice makes perfect. Signing off from Periodontal Therapy.